Okay.
So my name is Margie. I'm a registered dietitian and a certified diabetes educator, just like Debbie. And I learned so much from Debbie. And so I'm just so glad that I'm also be able to come alongside and encourage this group. The topic today is cardiometabolism. And it's kind of a new buzzword, and really and I'll go into the definition of it, but it's really talking about we've always treated diseases as separate. If you have diabetes, you get treated for diabetes. If you have high blood pressure, you get treated for high blood pressure. What we find now is that all of it affects your metabolism, the way you process food, and increases your risk. There's actually, they're expecting to have a specialty that physicians in about 10 years, as part of internal medicine, will have a cardiometabolism specialty. So if you have heart disease, you may go to a cardiologist that specializes in cardiometabolism. I'm going to share my deck now and go through the slides, but we will stop at various points to ask, so I could ask you questions. And also, Linda, you could let me know too if you want me to stop at any point. Does that sound good?
Sounds great.
Okay. And where is it?
So there you go.
All right. So we're talking about cardiometabolism, but as we're going through the slides and we're having discussions and talking about the topic, I really want you to be thinking about in your own life what behavior change in even a nugget of something that you hear can be put into a goal that's going to improve your health. Do you, Linda, do they talk about SMART goals in your program?
We have, but review is never a bad thing.
Okay, great. So behavior change is really hard. Even when I go to any kind of conferences, I listen to the information, but rarely do I actually take a nugget and shift my lifestyle. So when you listen to this presentation and the future Zooms, I'm just asking you to think about, with any of the information provided, even one thing, can you make a specific goal? Specific such as, I will eat a green leafy vegetable every day. That is measurable, so you'll be able to go back and say, did I eat a green leafy vegetable every day? It is actionable, it's something you can do. Often I see with goals, people will make them not really realistic, pretty lofty. They may say, I'm going to eat a green leafy vegetable at every meal, for example. And even though that sounds great, that might not be realistic. So I want you to think of a goal that will be a change for you, so an improvement, but something that's a realistic as a next step. And then the next, with the realistic, you think of a timeline. I'm going to have a green leafy vegetable every day, but for the next 2 weeks, allowing you in 2 weeks to say, did I meet my goal? And then give yourself some kind of reward, whether it's a happy dance or whether it's getting your nails done or buying a new book or just calling a friend celebrating your success. So please, again, I don't want this information just to be words or more information. I want this information to really lead to some kind of lifestyle improvement. Does that make sense?
Yes, but could you show the whole slide at once? We're not getting to see the information on the right.
Let me see. I think it's because you're, how do I move this?
You need to start the slideshow.
Slideshow, there we go.
There you go.
that better? Okay. Okay. So now that's that one. So we're going to talk about, so we're talking about SMART goals, and then we're going back into the, have you heard of the terms cardiometabolism or cardiometabolic disease syndrome? Has anyone heard of those terms before?
Not me.
No.
No, so this is new maybe for both of you with these terms. Okay, so you'll be hearing more and more about it, and we'll discuss that in a few minutes. So these are the learning objectives for today. One is I want you to be able to describe what cardiometabolic syndrome is. I really want you to be able to measure and understand how cardiometabolic risk is calculated and how you could even measure your own risk and what contributes to risk. I want you to understand the role that obesity and insulin resistance plays in disease progression. Understand that heart disease progresses over years. All of you are in this program for some type of heart disease, and even though you might have been diagnosed 3 years ago or a month ago, this actually started decades ago. To know the difference between healthy eating for primary prevention, and that would be general healthy eating to prevent starting of disease, and actually the diet, which is really for established heart disease and reversal. And we already talked about the SMART goals, but learning objectives at the end that you're going to have one goal that you want to go ahead and work on. So cardiometabolic syndrome is a cluster of diseases that often occur together. And these factors put you at a higher risk of cardiometabolic disease that will eventually progress to some kind of heart disease. The first one, if you're a man with a waist circumference of greater than 40, or a woman with a waist circumference of greater than 35, you're at higher risk, even if you don't currently have a diagnosis. If you have a blood pressure of greater than 135/85, or on hypertensive medications, that's a risk. If you have a low HDL cholesterol, and that's what we call the good fats, you want that high. If you're a man, if your HDL is less than 40. If you're a woman, if your HDL is less than 50, you're at greater risk. In your full lipid panel, if your triglycerides are greater than 150, that's a risk. And if you have prediabetes or diabetes, and that's anyone with an average blood glucose above 100 is pre-diabetic, you're at greater risk. Now, I want to point this out to you because many of you may be in the pre-diabetes realm, so your average blood sugar is greater than 100, but your primary care doctor or even your cardiologist has not mentioned that you're pre-diabetic. And that's really important for you to look at because the recommendations is now to go ahead and address and treat pre-diabetes, especially to reduce cardiovascular risk. So if you do have a piece of paper by you, and if you know that you have any of these risk factors, please take a note of that. Or if you don't know if you have these risk factors, maybe take a note and you want to go ahead and make sure that you look on your labs within your medical chart online with your healthcare system, or you ask your healthcare provider, because I want all of you to be able to speak to these risks and know your risks so you're in the driver's seat of your medical care. If your provider is not paying attention to these things, I want you to be able to pay attention to these things. And the reason is that all of these will progress to disease, cardiovascular disease, without intervention over a matter of years. So the more cardiovascular and metabolic abnormalities you have, the greater your risk of a cardiac event. And so, as you know, those things that I just showed you, the more of those you could check off, the greater your risk. So even if someone has not been diagnosed with heart failure or has not been diagnosed with coronary artery disease, these most likely will develop over years. And really what we're finding is it's not just the diabetes or prediabetes, it's just not the high blood pressure, it's that they really end up creating their own big disease. Almost like the California fires, there were individual fires that maybe weren't that bad, but collectively, as they all merge, it creates more abnormalities and your metabolic syndrome goes more awry to make even larger risk. So we're going to discuss a little bit about the risks. And one is obesity. You know, I don't like that term. It really has negative connotations. The clinical term of obesity really is if you're above 30% of above your ideal body weight, you're considered obese. Now, we want to catch it when someone starts becoming overweight. But again, when someone becomes more than 30% above their ideal body weight, it adds an increased risk that leads to cardiovascular disease. One is insulin resistance, meaning that your body makes insulin to help bring your glucose levels down, but we find that your body does not respond as well often, and it takes more and more insulin to control your blood sugars. Again, which is a strain on the body, and it makes over time your overall blood glucose can be higher. Obesity eventually and insulin resistance could lead to diabetes. We know that disease often starts with inflammation in the body, and without inflammation, for example, even without inflammation in your arteries, that high glucose, the high cholesterol will not stick. So inflammation really is the petri dish that really causes a lot of diseases to progress, even like arthritis. And then obesity eventually with the inflammation, high blood sugar, abnormal blood sugars leads to heart disease. Now, those of you who are a pear-shaped, like I am, what happens is we do find that as long as your waist circumference is healthy, you do not have as increased risk if you're a pear and carries your weight around your hips and thighs, where those who carry their weight around their abdomen are at greater risk. So if you are someone who's overweight or considered obese with abdominal body fat, I really want you to go ahead and try and reduce that risk factor and work to lose weight and work with the health care professional to lose weight around your tummy. So what this really shows is kind of how weight and insulin resistance kind of is all connected. So you have increased blood sugar, and it may be increased caloric intake that leads to increased body weight. That increased body weight then leads to your insulin not working correctly, and your blood sugars go awry. Your body's not able to lower blood sugars as readily, leading to prediabetes and diabetes. But also we find over time that higher blood sugar leads to your lipid panel, your cholesterol, your triglycerides, those numbers not being healthy for you. And it's all connected, and that's why we call it cardiometabolic syndrome. Does anyone have any questions about that part? Hey, Linda?
I think they would speak up if they did, so.
Oh, good. So they're unmuted, so you'll be able to hear them. Yeah. So at any point, just like indicate to Linda if you have a question. Okay. So we talked about insulin resistance, And again, it's almost like our body is a big train with all these different cars that have to go in the proper order. And if one of the cars goes awry, it throws off the other ones. So some important things that are related to not only diabetes, but heart disease is insulin resistance and insulin. So as you're in a cardiac rehab program, I want you to understand the role insulin and insulin resistance may be playing in your heart disease. So all of our pancreases make a hormone called insulin that our body absolutely has to have to regulate the amount of glucose or sugar in the blood for energy. So for example, if I were going to go ahead and have a meal, and let's say it's a meal with some whole grain rice, with tofu and vegetables, no matter if it's a healthy meal or an unhealthy meal, my pancreas, my brain will know that my blood sugar is going up. It signals to my pancreas to shoot out insulin because everything that I ate will start raising my blood sugar. The insulin is released. Insulin helps open up the body cells so that blood sugar will go out of my blood where it's not healthy for me, and it'll go feed the rest of my body. And so it promotes absorption of that glucose, and that's when your body's healthy. Now we do know that if someone has like sugar drinks, for example, like it could be something we think might be healthy, like Gatorade, or it could be drinking regular soda, or it could be drinking orange juice. It's those liquid carbohydrates or liquid sugar that raises our blood sugar the fastest. If someone is having a low blood sugar, it only takes about a half cup of juice to spike that blood sugar up to get them out of trouble. So you could understand then if someone's having liquid sugars, like drinks with carbs, or if someone has a lot of candy, or even too many carbohydrates in one meal, your body needs even more insulin to bring that down. And if you have insulin resistance, your body's not responding properly. So it's taking more of an effort to bring your blood sugar down, and your blood sugar will not go down within the 2 hours that a healthy body does. So just so you know, more sugar at one time, more carbs at one time will make it harder for your body to respond. And that's why more of a lower carb meal can be helpful, especially in people who are developing insulin resistance. And that's your body's inability to really utilize the insulin that it's making. And so your body's not responding. Your body's having to produce even more and more insulin to control blood sugars, and taking longer to control your blood sugars. And that leads to weight gain, inflammation, and can lead to prediabetes, diabetes, and heart disease. So that's when we talked about smaller amounts of carbs at one time and smaller portions of meals, how we could really help our body control weight, inflammation, and actually eventually heart disease. So a lot of times primary care doctors use something called an ASCVD risk calculator, and it calculates your 10-year risk of a cardiac event, and it's intended for primary prevention. So that's like the regular doctor that you would go to. Okay, so if you have a smartphone, if you go to the apps, you could go and actually get an application that's and put in ASCVD risk calculator, and you could plug in all the numbers and you could calculate your own cardiac risk over the next 10 years. And really, you're in a cardiac rehab program because either you're reversing heart disease and you're definitely trying to work to reduce your cardiac risk. And some of you, it's of a first event, and maybe for some of you, it's a second event. And so within these applications, you add in your age and sex, blood pressure, total cholesterol, and you see all the different factors in the screen, and then it'll be able to go ahead and let you know what your risk is. I put it in mine, and my 10-year risk is 1% of having a cardiac event in the next 10 years. One of my friends who has prediabetes, also high blood pressure, that she's being treated for and high cholesterol, her 10-year risk was 17%. And I'm really trying to work with her on a plant-based diet and losing weight because for me, I don't want my friend to have a 17% risk of having a cardiac event in the next 10 years. I love my friend too much for that to happen. And so this kind of tool may be a good window into what your risk is that you could also further discuss with your healthcare provider. So these are the things that usually measures. Again, if you're looking at cardiovascular risk, you look at your full lipid panel, the different kinds of blood fats. And then now they're also looking at some of the inflammatory markers that you could discuss with your doctor. And of course, if you have prediabetes or diabetes. And so when we talk about primary prevention, and this is again before someone has established heart disease, we really want a lifestyle that starts in childhood because diseases start that younger. It starts over years. So a general healthy lifestyle is to limit saturated fats, and that's the fat from animal products, and trans fats from processed foods. So it's really starting everyone on a diet that's more whole foods and not processed foods or saturated fats. Processed foods have a lot of sodium, as well as we don't want to get in the habit of adding sodium at an early age with our families or grandkids, trying to encourage people to learn how to love foods that are seasoned with lemon and lime and herbs and garlic and onion and anti-inflammatory seasonings. Limit sugars. In other countries, fruit is considered the dessert, and I wish that we could do that more in our country. Eating vegetables every day, including especially leafy greens every day. Eating fruits, whole grains, and that food label needs to say whole grain, not just wheat. It needs to say whole grain, preferably 3 grams of fiber or more per serving. If you eat milk or milk products or dairy foods, make it non-fat or low fat. Choosing lean proteins that could be plant-based, like peas and beans, and it can be tofu, for example. It could also be like like chicken breast without the skin is another lean product. Really work on keeping that waist circumference low, and also a minimum for everyone starting throughout their, in their adult life and earlier is a minimum of 150 minutes of physical activity a day. That's 30 minutes a day, up to a minimum of 300 minutes a day. That would be an hour a day of physical activity. Man, that takes work. I know here at the clinic when I'm working, I try and walk 15 minutes during the day somehow. And then after work, I try and do 30 minutes. But we really need to be purposeful in getting that physical activity, especially during COVID when I think that we're more isolated. So is there any questions about that? Are we good? They might be things that you've heard before. So one of the things that is so important to me when I think of cardiometabolic risk, but education in general, I don't want there to be recommendations that people are telling you to do this, but you don't understand the why behind it. Because I think in order to really be bought into changing a lifestyle, you need to understand the why. So please, whether it's part of the Sacramento State program or when you go to the doctor, if someone's telling you to do something and you don't understand the why behind it, please ask them or do your research. But I really want you to understand what's happening to your body. And so in general, the reason that the high sodium intake harms our body, and there's the 4 areas right here, really it is a state of inflammation in our body, and it can increase our volume, our blood volume, making it harder for the heart to pump. Also in the kidneys, it could prevent the kidneys from removing excess fluid, which causes your body to retain more water. And also salt on the brain. Too much salt will strain or damage arteries that can lead, could be in the brain, and that can actually lead to dementia due to reduced oxygen and nutrients to the brain. Interestingly, that excess salt in our diet started with the Industrial Revolution, with our wanting to find a way to make foods more shelf stable. And as we know, like when we buy whole foods or go to the farmer's market, a lot of times they start getting soft or rotting within 3 days. And so foods on the shelf stable, could last like a year or 2 years, and much of it is because of the sodium and other additives. What we're finding that although that helped us have more freedom and not having to do meal prep and go shopping so often, and there's benefits of having more shelf stable food, um, the overall effect on too much processed and shelf stable foods on our lifestyle has really considerably added to disease. And so learning to get away from the shelf stable food, unless we have to for whatever reason. And for me, I do keep some frozen vegetables in, because for me, if I want to get my vegetables, and that's a great fallback if I don't have any fresh, or if my fresh have spoiled. But again, we want to look at the sodium and then really watch how much canned products we get. So we're talking about general guidelines, and that's general guidelines for recommendations for preventing heart disease. Now, this particular slide I've used here at UC Davis Medical Center, and everyone in the room has had some kind of cardiac event, a stroke, a heart attack, a life-saving procedure, or they're living with advanced heart failure. All of them have to have an ejection fraction of less than 35, and many of them have diabetes. So I do want to think it is very different if someone maybe has is prevention, maybe they have high blood pressure and maybe they have prediabetes, but they don't have established heart disease. We need to go ahead and be, I would say, even stricter with someone as a reversal diet, or someone who has established heart disease, than someone who's trying to prevent it. So if you already have established heart failure or coronary artery disease, this is no longer about primary prevention. It's about living with established heart disease risk, reducing your risk, and also it's about healing the body that's already damaged. And so those diet recommendations, what we might want to do is maybe different. So this goes to the notion that heart disease starts with genetics for many of us, an unhealthy lifestyle, and goes to lipid abnormalities, overweight or obesity, stress, and insulin resistance. It all contributes to heart disease. It progresses over years, leading people to cardiac rehabilitation, and that supports intensive and lifestyle treatment more than just prevention. Your body needs intensive lifestyle in order to heal and prevent the future disease. So I want to talk about kind of diabetes and heart disease, and also blood pressure and other things that you may be struggling with, and talk about how it did progress over years, and how now we need to go ahead and be more serious. Okay, so if we think about prediabetes and heart disease, I find it to be very rare that someone has prediabetes, and that's an average blood sugar above 100. Your A1C would be, hemoglobin A1C would be 5.7 to 6.4. I rarely hear a primary care physician or any physician discussing with the patient, you have prediabetes. This is increasing your risk of cardiovascular disease. And if you don't make a change, you could have a cardiac event. I think as medicine, we're going more in that direction of taking this more seriously early on, but I really hope as a society, that's where we're going. And so really, if you look at the far left, we have normal blood sugar, and you see the blood sugar rising, and that would be like over a 15-year period, maybe even before someone's diagnosed with diabetes. And so we're having normal blood sugar, and then prediabetes, and then clinical diabetes and complication, it's a 15 to 30-year process before that diabetes may lead to a cardiac event. So again, normal blood sugar is fasting, like in the morning when you wake up, less than 100, and a hemoglobin A1C, or an average blood sugar over 3 months of less than 5.7. Okay, you have pre-diabetes, is if your fasting blood sugar when you wake up in the morning, if it's between 100 and 125, or a hemoglobin A1C of 5.7 to 6.5. If you are you're in a cardiovascular, you're in a program, a rehab program, if you are living with pre-diabetes and your medical provider is not treating that with something like metformin, I would discuss it with them, because we do know that treating it early provides more cardiovascular protection and considerably lessens your chance of actually progressing to diabetes. That's treating pre-diabetes with, of course, metformin, but also intensive lifestyle changes to go ahead and prevent the progression. And then a diagnosis of diabetes is a blood sugar of 126 and higher fasting, or an A1C of 6.5 and above. Sadly, I've seen patients here in cardiology and cardiac rehab that they had diabetes and no one ever told them they had diabetes. And so that's amazing to me. And so do you know your blood glucose number? If you do not, please go ahead and look on your electronic health record, look at those numbers. If you don't have those numbers, next time you go to the doctor, go ahead and ask for them. So this talks a little bit about, that was the progression of diabetes. This is the progression of atherosclerosis. On the bottom of the chart is years. So we're talking like years of life. And so considerably speaking, someone could be having maybe unhealthy lifestyle with inactivity, with processed foods, too much saturated fat, inflammation, and they may not start having progression of disease until they're 30. If you look at those numbers, and then they don't have an event until 60 or 65, and this was happening all along and they didn't know. And so if we look at the top there, it's your artery. It starts with a fatty streak. If you have uncontrolled blood sugars, that inflammation and the stickiness, of that sugar in the blood can create more of an environment that then if you have high cholesterol or even genetics or food, it's more likely to stick. And so that's kind of the combination of how diabetes greatly increases your risk of coronary artery disease. And it kind of all works together. And it makes sense. If you put sugar water over the top of your hand, it's going to get crusty and hard and sticky. In some respects, that's kind of what's happening inside of our body. It's also creating more rigid arteries that our body, the arteries are less responsive to blood flow. So if we look at hypertension, I know I have to watch my blood pressure. I'm finding now when I go to the doctor, I'm probably more pre-hypertensive that I've never seen before, but I do want to keep an eye on it. I don't want to all of a sudden go to the doctor 10 years from now and be in hypertension stage 2. So normal is less than 120 over 80. Pre-hypertensive is 120 over 39 over 80. And you go through the stages. Stage 1 is 140 over 90. Stage 2, 160 over 100. And then really people have strokes and their blood pressure has been out of control for years on and off, and they didn't realize how bad it was, and there you go, and so definitely diet high in salt can be part of that. Stress, this is a really stressful time right now for all of us with COVID and everything going on. Managing stress is so important. And also if you have diabetes or coronary artery disease, you're going to increase your risk of hypertension related to stroke. Okay, so heart failure, there's different stages in heart failure. Again, nothing about the time you're in heart failure that you're being treated by a cardiologist. That's years into the process. And this kind of does an overview of risk. So in stage A here, really you're at increased risk of heart failure if you have coronary artery disease, high blood pressure, diabetes, alcohol abuse, also family history. And heart failure pretty much so is that the heart has worked so hard or overworked so hard that it actually, or you have so much volume overload, so much fluids in your body, and your body has to work extra hard that eventually it gives out. I have a family member in his 20s who is morbidly obese. It's scary for me because he wears a smartwatch, and when he just walks down the block, his heart rate is above 130, which would be an exercise, like an aerobic workout. So someone like him, when just daily activities of walking increases his heart rate like he was jogging, that means as long as he's overweight or obese like that, his heart clearly is overworking. 30 years from now, he may have a difficulty with heart failure, and something we know that all goes together. So I know that Debbie Lucas has just done such a great job of presenting the plant-based diet. I know for myself here when I work within cardiac rehab, even though people have had an event, I'm surprised that the response to a plant-based diet is, oh, that's drastic. And now I'm thinking, okay, this isn't about prevention anymore. Disease is there. We need to reverse it. So it may seem drastic, but I think of it this way: isn't coronary bypass graft surgery, isn't that drastic? Or isn't having to put a stent put in drastic, or a device, because your heart's too weak to pump? And so I love the fact that we have life-saving procedures, but a lot of this could be prevented, or at least greatly improved if we're willing to be more drastic with our plant-based diet choices. So Dr. Dean Ornish really wrote a book, his first plant-based diet book, about reversing heart disease in the 1990s. As a Western trained registered dietitian nutritionist, I actually worked on a cardiac floor, and I thought this was crazy. Like, come on, we're going to do that. We have margarine, not butter anymore. We're doing more, less saturated fat. Certainly people could have their meats. This whole thing about, vegan or vegetarian is ridiculous. And so now, all these years later, what Dr. Dean Ornish was talking about in the 90s is becoming standard of care. Kaiser Permanente in their heart disease program recommends plant-based eating. In all the major medical centers across the country and actually the world, plant-based eating for prevention now, not only treatment and reversal, is what's given. So there's verified research to show that a plant-based diet can actually reverse heart disease. So what I'm asking you is why you're in the Sextate program, that you use this time when you have support and a lot of resources to evaluate where you need to go, what's the next SMART goals you need to make, what do you need to do to change, heal, and reduce your risk. And the areas of lifestyle, I'm sure you know, but it's good to review, is healthy eating, regular physical activity. And healthy eating, I would say plant-based, at least plant forward, regular physical activity, healthy relationships, stress management, and good sleep hygiene. Now, only you can say maybe you have the diet down, maybe you're doing great with the diet, but you're sleeping 4 hours a night. Or, so all of us need to look at what are your greatest risks, and what, as you're in the Sextate program, can you identify that and ask help for the area that's most important to you. This I'm going to speak a few minutes about cardiac risk with the keto diet. So when we think of plant-based eating, we do get protein, but it's from tofu, from nuts, from beans, is some of the main sources of protein. And some of those foods are a little higher in carb. It's a big fad, and I know I see people being successful following the keto diet. And so what they do is they increase their intake of fats and meats and lower their carbohydrate intake. Going into what's happening is your body's burning fat and protein. It's ketosis, they call it, to lose weight. And yes, this works. The issue is the popular keto diet really recommends if you want to have heavy cream every morning with your coffee, you're fine because it's not a carb. They're not necessarily limiting the fat from animal sources. And so what we're finding though is with that keto diet, we're seeing really increased levels of cholesterol, especially LDL cholesterol and fatty liver. And it's well established in the literature that increased saturated fat increases your heart disease risk. So there's doctors on the internet that are saying that it doesn't make a difference if you follow this high fat keto, if you have cardiovascular disease, that it's okay. Now, I do beg to differ for you. You may have improved numbers because you've lost weight from this diet, and maybe even your blood sugars have gone down. But in the long run, if you have increased saturated fat, you are going to increase your risk. And here at UC Davis, we've seen quite a few patients that have lost weight through keto and they look great. And then they have a heart attack or stroke and they get off the popular keto diet. Now, you could eat ketogenic. Ketogenic means lower carbs and more lean proteins and more plant-based proteins. So you could eat ketogenic and have some of the same effect without following the popular keto diet that does not care about how much animal fat you have. So again, the plant-based diet is the only diet medically recognized to reverse cardiovascular disease. So it's interesting, my husband and I have been going more, I would say vegetarian than vegan. So going, I would say plant forward. We do eat, we do know that like chicken, like a chicken breast, lean chicken does not help or hurt cardiovascular disease. It's neutral. The research also says non-fat milk products are neutral for non-fat. So some people choose to go vegan and some people choose to go kind of a combination, but it's the improvement. But we are looking for to eat more vegetables. So every day have 3 to 5 servings, and also make sure you're getting leafy greens, and then you're avoiding meat-based meals. This is interesting because as my husband and I do meal planning, we've been doing plant-based, and yet last week my husband, when he went to plan a meal, he was like, oh, like we're gonna have pork chops this day and we're gonna have fish the next day. For years, for my whole life and his whole life, when we do meal planning, the first thing we think about is what meat we're having, and then we build our plate around it. Or we think, what carb? Are we having pasta? We think what carb and we build our plate around that. It is a huge family cultural shift for us to think about now, what vegetables are we having and what protein are we putting as almost like a condiments with the vegetables. So you may have to make that shift first, that how do you start making the vegetables as the core part of your culture, of your family culture of mealtime. So we want to eat more whole fruit and less white sugar, and the fruit can be said being a replacement for some of that sweet tooth. I also have like 80 to 90% dark chocolate, a little piece every day that helps me. Eat more whole grains with the word whole in the label. Avoid white flour. Eat more herbs and low salt seasoning and avoid salt and salt seasonings. Eat more legumes, beans, nuts, soy, and milk alternatives, and avoid meats and dairy with saturated fat. And so I do want you to focus on all that you can eat as opposed to all that you can't eat, and really work to making that transition. So in terms of with all that we talked about today, which I know it's a lot of information, thinking about a SMART goal, what specific choice can you make or goal can you make this week to work towards? So Linda, do you want to open it up for questions and if people want to share what their goals are?
Sure, that's up. Everyone knows how to unmute themselves.
Hi, this is Tony.
Hi, Tony.
I have a question. So if you've been a diabetic for a long time and, you know, you weren't so healthy all those years, but now you've changed like you're eating healthy and exercising, does that kind of reverse some of the damage?
Yeah, you know, it can. And so there's definitely, I think that the biggest change people could make when they have the A1C of like 7.5 and less, and if there's really drastic lifestyle changes, then you have the most reversal. You know, that there's the most change. We do find that diabetes can be, and in many cases is a progressive disease, because over time, slowly over years, you can lose more beta cell function, meaning that you're going to have less and less insulin released. So in your situation, it really kind of depends on where you are in that spectrum of disease. But in many situations, you will be able to definitely better control the diabetes and maybe even go off medications or some of the medications if you're able to make that lifestyle change.
I have lowered my insulin intake,
Oh,
but I
good.
was told, even though I'm plant-based for the most part, that I will never not be a diabetic because I've been a diabetic for so long.
Mm-hmm.
But my A1C is 7.2. I
Mm-hmm.
want to try and get it down below 7.
Mm-hmm. Well,
So
first of all, congratulations, really great job. And I don't want you to be disappointed in the sense of that means that you've lost enough of your beta cell function, kind of like even like a type 1 person living with diabetes, they just don't make the insulin. So if your diabetes has progressed to the point that your pancreas isn't making the insulin, there's nothing more you can do except eat healthy and then take the insulin that you need to manage your blood sugar.
but will that repair some of the damage so I don't have heart disease, possibly?
Yeah, definitely. I mean, I think the thing is the plant-based diet, even with your diabetes, even though you may always need to take the insulin, it definitely can assist in progression of cardiovascular disease. I can't guarantee that you're not going to have an event, but definitely if you make diet improvements, it's definitely going to be better than if you didn't do anything.
Okay, thank you.
You're welcome. Great job on those changes, though. That is getting down to a 7.2. That's really great. You know, I do want you to talk with your personal dietitian or endocrinologist or cardiologist about your A1C goal. Sometimes when someone has established cardiovascular disease, they don't necessarily recommend having too tight of control. And you could talk with them about that.
Well, I'm happy with the fact that I went from like 30 to 50 units down to 2 units.
Wow. See, that's a
So,
huge change. Great job.
yeah.
Really good job.
Okay, thank you.
I've got a question about egg whites or vegetable oils. I wonder what's your opinion of using those in cooking?
Yeah, and so in terms of egg whites, so you know, when we think about whole food plant-based, and then sometimes some of us, not, you know, maybe someone's choosing to go, you know, all 100% vegan. You may have your own personal reasons of why you want to go ahead and have egg whites. You know, egg whites don't have the saturated fat, and so I like the possibility and just the flexibility that I have in adding egg whites to my diet when I want something different. I could easily make a frittata with egg whites and lots of vegetables.
Right.
Yeah. So again, I don't egg whites, you know, in the spectrum of thing isn't anything that I would be concerned about in terms of that. In terms of the oils, so it depends if you're doing the strict reversals, cardiovascular reversal program, and reversal really in that term, and if that's something you've decided with your doctor and with people who work with you, that is less than 10% calories from fats and oils. And so that in that situation, you always want it to be a plant-based source. Example, cold press olive oil is actually one of the best choices. Grapeseed oil is another really great choice. You want to stay away avocado oil. I would say organic canola oil because it's soy. But I would stay away from palm oils,
Mm-hmm.
coconut oil, because as you could
Mm-hmm.
see, because it's hard at room temperature, it's
Mm-hmm.
saturated, it's sticky, you know. So those are the oils that I would stay away from. A body needs fat. And so none of us wants to go no fat. The total non-fat of the 80s diet doesn't work.
Mm-hmm.
So you definitely need small amounts of fat in your diet, spread kind of evenly throughout each meal. For those of you who want to lessen the fat, like in cooking, for example, I think the nonstick pans, the PAM spray. Also, if I'm sauteing, I use a little bit of water, or sometimes I even use a little bit of vegetable broth.
Mm-hmm.
You could even, a lot of times the chicken broth is actually very lean, you know, it doesn't have, the fat in it. So broth could help you cook without the oils. Does that answer your question?
Yes, it did.
Good.
So you're saying if we're going to use any oil, then cold pressed,
Mm-hmm.
avocado,
Grapeseed.
olive, and grapeseed.
Yeah, and cold press olive oil. And
Right.
so it's about the processing, you know. So
Yes. Yes.
yeah, so someone who is like, really strict, vegan or like that, we're looking at the processing. Olive oil is great. The cold pressed olive oil is less processed.
Mm-hmm. Okay.
Mm.
Thank you.
Oh, you're welcome.
Is there something I should be asking that I'm not?
Um, it's so in this kind of situation, because I don't work with you as closely, I don't know your particular situations, but Debbie does such a good job, and you have other people there that be sure to like think of those questions, or even when you're around your day or week, have a little notepad and write down your questions, and that way when you go ahead and connect with this program, with this community, which is a fantastic support community, you could bring those questions back.
Well, may I ask another question?
Oh, sure.
Um, okay, so we're to avoid white flour.
Mm-hmm.
Any flours?
So the thing is, though, is we think about processed and nutrients,
Mhm.
so really so white flour, there's some fortification of nutrients, but there's really no fiber in it, right?
Right.
It's high in calories. It's not really high in nutrient value. I would not consider it whole food because it's a processed food,
Of course
right?
not.
Yeah.
Right.
So the thing is, though, is that if you, if you want to have, for example, if you're having bread or a grain, you want to look for a whole wheat or a whole grain. And so if you're baking, there is like whole grain flour for some things, and it's more than 30%, more than 3 grams of fiber per serving, it would be considered whole grain.
Okay.
Yeah, and so this is like, so amazingly to me, and I've just really enjoyed this, I've found recipes where you omit the white flour and you use beans.
Mm-hmm.
And it sounds crazy, and I've been a dietitian for years, and I've never practiced this before. But I literally have made brownies where
Oh,
you take the black beans
yeah.
and you rinse them out, and then you dry them and pat them dry, just really, really, really dry, and you put them in a blender. And when you put in all the other ingredients, you do not even know that there's not white flour in there.
It's the same thing like wheat cake.
Yeah, yeah.
Yeah.
Mhm.
Yeah.
So I think that you're getting the carbs, but you're also getting the carbs with fiber and all the nutrients of a whole food. There is, I do like my sweets. I like my things. There's a site called at Chocolate Covered Katie. That's her name. Okay. She's on Instagram, and it's one of the best, so I'm saying this to you in the sense of that they are kind of extra foods, although
Yeah.
I made her, she had a baked oatmeal that was fantastic, and it's almost like you cut the oatmeal like you're cutting a brownie square. And so some of the stuff really is helpful that you could go ahead and have as a snack, and get a little bit more of that sweet, but it's not using any white flour, and they're also giving alternatives for even some of the sugars as well.
We've been using monk sugar
Uh-huh.
for some things, which in for the most part, it works fairly well. Is there another sugar substitute that's better?
Yeah, and it's kind of more about like what you're looking for,
Yeah.
so monk fruit really is great. Swerve works for some people, although I don't like some of the aftertaste.
Yeah, really.
Yeah, Splenda works. I think I like Splenda in certain amounts. And depending on your caloric need, and also if you have diabetes and things, you can use small amounts of, organic maple syrup or even some honey. We do want to watch it because it is sugars. But again, I think that there is some nutrients in it and it's not processed.
Okay, thank you.
You're welcome. Anybody else? Can someone share their goal? Like, what are you going to work on this week from this presentation?
I'm going to try to add vegetables to my oatmeal.
Oh, wow.
Well, remember that when we were at Jack's, he made that savory oatmeal with avocado.
Yeah, good job. The avocado sounds really good. I've had a rosemary oatmeal that was fabulous. It was such a good addition. I just love that, especially if you think about it with winter coming here and having some like a little bit more savory in the oatmeal would be good. Turmeric's another thing you could add to oatmeal.
Yeah.
Well, I'm thinking spinach or Swiss chard.
Yeah, you could. Yeah, definitely. And that's a great option. Another thing you can do is consider other grains for breakfast, like quinoa. You could have quinoa for breakfast.
Can you talk some more about the baked oatmeal you were talking about?
Yeah, so that really. So Google chocolate covered Katie, Katie, baked oatmeal. I'm sure the recipe will come up.
So what kind of oatmeal do you suggest? Do you have
I do the instant, but actually if you had more time and everything, definitely the steel cut.
Yeah.
Or like that's always better for me. It's more like I pre-plan and bring all my meals to work every day, and so sometimes I just don't get around to doing the batch oatmeal. So I use when I can an organic instant oatmeal. I find that grocery outlet, it's amazing to me, is a great place to get some of these healthier, even some of the sweeteners and things for cheaper. You just need to watch the dates on some items, but they're fantastic.
Well, my wife takes our steel cut oats and she sautés them, heats them up, and toasts them actually in a saute pan.
Oh, delicious!
Until they're quite dark, and oh my gosh, it's absolutely delicious.
Yeah, you know what? And I think I'm amazed. And like I said, I've been a dietitian for years, and I've worked in cardiology before, but I just took this job at UC Davis in May within cardiac rehab. And it's and I'm just be honest that even like making this real for us every single day is a lot of work. And
Yes, it is.
It's even a lot of work for someone like me that has some experience in this. But it can be delicious. And even though I'm a healthcare provider, I'm continually amazed by what we can create and how tasty it is.
Yes, agreed.
So any other goals? I love that vegetable we don't get enough vegetables, so getting vegetables in breakfast is fantastic. And any other thoughts?
Less sugar.
Less sugar.
Less sugar, yeah. Like I know everyone was going to say your goal is check out at chocolate covered Katie. Yeah. So just know that too much at chocolate covered Katie, even though it tastes good and there's beans in it, can add extra pounds. So even that has to be in moderation. But 100% cocoa actually has a lot of antioxidants and is actually really good for us. I put cocoa, just 100% cocoa, and also cinnamon in my coffee every morning.
Yum.
Yeah, so just a great way. And I think it was Debbie, one of Debbie Lucas's presentations over the last couple months, when she mentioned, and I'd never heard that concept before, about trying every single day to at least get 30 different vegetable sources, and it can include your spices and seasonings. So it's been really fun for me. Like, wow, I had my coffee and I already had two, so, so really trying for the 30 a day and then actually working towards the 50 a day, which I'm still working towards.
Mm.
Wow.
I'd be happy with 20.
And that's perfect. What you can do is count where you are, like just this week, kind of just off the top of your head. Okay, what did I have, including your spices, and then have that be your specific goal. Maybe you find out that on average you have 10. So then your goal for the next week maybe is 12 or 14. It's not about perfection, it's about progression.
Amen. Preach it.
Yeah.
Yeah.
And also, I also have just another thought that's kind of reminds me of this is, I was working with someone in our gym and she's living with diabetes. She had a gastric bypass several years ago and has kind of gained weight past the gastric bypass and has just continued to struggle with her weight. She's above her weight goal, but she's at a healthier overall weight. And through cardiac rehab, it clearly shows all her numbers are better. Her diabetes, her blood sugar numbers are better. Her ability to exercise in the gym is improved. So all factors except the scale has shown that she has greatly improved her health and reduced her risk. So even with you all, I just want to let you know that scale is not the only measure. And again, it's not, I don't want anything you look at to feel like you feel like, oh, I failed. It's not about pass or fail. It's about progression and really rewarding the efforts that you've made. Especially now with this whole COVID, I think if anyone was going to gain a whole bunch of weight, I think it would be now, because I think it's a really hard time. So really want you, as you go into this winter that might be really stressful, to dig into your health goals and just make sure that things don't get worse through this really stressful time. So are there any other questions?
Thank you very much.
Oh,
Yes, thank you.
Thank you.
Welcome. Thank you. I so enjoyed getting to know all of you, and I'm sure I'll be seeing you on a WebEx or Zoom in the future.
Yes.
Lord willing.
Okay. Take care. Have a great day.
Thank you so much, Margie. This
Thank
was
you so
great.
much.
Thank you.
Thank you. Take care.
Bye, Linda. See you this afternoon, I hope.
Yep, I'll be there. Take care.
Bye-bye.